Before watching this video, subscribe our channel, press on bell icon to get more updates. Hello friends, my name is Dr. Talha Miraj and today we will discuss ketamine hydrochloride. Ketamine hydrochloride is an analgesic, is an anesthetic drug which is used for the general anesthesia. Generic name ketamine hydrochloride, chemical name 2,2-chlorophenyl 2-methyl amino cyclohexane. Molecular formula C13H17Cl2NO. Molecular weight 274.8 gram per mole. Drug category general anesthetic. The ketamine is a NMDA receptor antagonist which is with a potent anesthetic effect. It was developed in 1963 for the replacement of phencyclidine, which is also known as angel dust, and this drug was developed by Clement Stephen in Parke Davis Laboratories, and now this drug is used for the purpose of general anesthesia, and this drug was approved by FDA in 1970. And primarily this drug is used for veterinary purposes and in minor surgeries. Content: injection 50 mg per ml, 2 ml injection containing 100 mg drug, 5 ml injection containing 250 mg drug, 10 ml injection containing 500 mg drug. Pharmacology: ketamine hydrochloride is rapid acting general anesthetic producing an anesthetic effect characterized by profound analgesia, normal pharyngeal reflexes, normal or slightly enhanced skeletal muscle tone, cardiovascular and respiratory stimulation, and occasionally a transit or a minimal respiratory depression. The mechanism of action is primarily due to the antagonism of N-methyl D-aspartate NMDA receptors in the central nervous system. Mechanism of action: ketamine interacts with NMDA receptors and opioid receptor and monoenergetic receptors, muscarinic receptors, voltage sensitive calcium ion channels, but it does not act with the GABA receptors, and this is how the NMDA and this ketamine block NMDA receptors and resulting into the general anesthesia, as it is in second line, that the result of blockage of NMDA receptor and hence cause general anesthesia. Drug absorption: ketamine absorption is very rapid and bioavailability is around 93%. After the first pass metabolism, only 17% of administered drug is absorbed. Distribution: is distributed very rapidly and present a distribution half-life of 1.95 minutes, and the Cmax, which is also known as maximum concentration level at level B reaches at 0.5 microgram per ml in plasma and 0.2 microgram per ml in cerebrospinal fluid. Its metabolism is basically hepatic metabolism, and the major metabolite is norketamine, and by transformation, by dealkylation, hydroxylation, and conjugation of gluconic acid and dehydrogenation result into the formation of cyclohexane and its derivatives. Excretion: 91% through urine and 3% through feces. Biopharmaceutics-of the drug: route of elimination 95% to 85% to 95% drug is mainly excreted through urine in the form of metabolites. Volume distribution is very high in central compartment, and in steady state it is 3.7.371.3 ml per kg and 4060.3 ml per kg respectively. The clearance rate of ketamine is high and around 95 liter per hour per 70 kg. The biological half-life of ketamine in preclinical studies was 186 minutes. Indication as an anesthesia, it is used as an anesthesia for operations of short duration and instrumental and painful diagnostic interventions. It is also used for the induction of anesthesia prior to the administration of IV anesthesia to potentiate the action of inhalation anesthetic of low potencies such as nitrous oxide. It is also used as in resistant depression. It is an off-label use of ketamine hydrochloride. Service level category: primary, secondary, and tertiary hospitals. Schedule G: only pharmacies can sell this according to the Drug Act 2007. Dosage: loading dose in IV is 1 to 4.5 mg per kg, slow IV administration and once, and alternatively off-label 0.5 to 2 mg per kg IV if adjunctant drugs such as midazolam are used, or intramuscular 6.5 to 13 mg per kg once, alternatively 1 to 10 microgram per kg IM once if adjunctant drugs such as midazolam is used. Maintenance: 50% of the IV ketamine induction dose administered PRN, which is mean on demand or on emergency cases, pre-ritanonata, 0.1 to 0.5 mg per minute, IV continuous infusion, resistant depression of level, infusion of 0.5 mg per kg twice weekly, not to be exceed 6 weeks. The therapy should be less than 6 weeks. Dosage in pediatrics: IM 3 to 7 mg per kg, IV 0.5 to 2 mg per kg used in smaller dose, 0.5 mg per kg for the sedation of the minor process and usual induction. For the usual induction, the dose should be 1 to 2 micrograms per kg. For continuous infusion, IV infusion 5 to 20 micrograms per kg per minute at lower dosage listed and titrated. Effect: maintenance 1/3 or 1/2 of the initial dose. Administration: do not exceed 0.5 mg per kg per minute or not administer that then faster. So it means that you don't have to administer the drug in less than 60 seconds. Do not exceed final concentration of 0.2 mg per ml. So the final concentration should not be 2 mg per ml. By slow IV injection over at least 60 seconds. So similar that is written in first line. Reconstitution: dilute with administration. For administration with IV infusion, prepare 1 to 2 microgram per ml solution by adding 500 mg to 500 ml or 250 ml respectively of dextrose water and normal saline. So it means that if there is 500 mg drug, you have to dissolve it in 500 ml dextrose 5% or normal saline and administer IM. Do not give 100 mg per ml preparation undiluted. Compatibilities with the substance or with the diluted. So these substances are normal saline, which is 0.9% NaCl in 1 liter of water, 5% dextrose, and sterile water of injection. Drug to drug incompatibilities. The IV incompatibilities as an adjective is barbiturates, diazepams, whereas fringe is concerned barbiturates, diazepam, and doxapram. IV incompatibilities with additives: morphine sulfate syringe, bupivacaine with phenyl, cholinidine with tetracaine, lidocaine with morphine sulfate, meperidine, and morphine titrate. Y-site incompatibility ceftazidime and propofol. Stability. Store at controlled room temperature, colorless to slightly shallow solution, may dark upon prolonged exposure to the light. This does not affect potency, but do not use it if the solution is precipitated. Protect from light. Ketamine hydrochloride is maintained at acidic pH for stability and solubility. If mixed with alkalizing solution, its instability or precipitation can be served. Contradiction: eclampsia, hypertension, and hypersensitivity. Eclampsia is a condition in which the pregnant woman can get high blood pressure or suffer from hypertension due to the hormonal changes in their body. Precaution: may cause dependence or tolerance with prolonged use. Discontinuation for long-term use has been associated with withdrawal symptoms and with psychotic features. Use caution in patients with coronary artery disease, catecholamine depletion, hypertension, tachycardia, and monitor cardiac function. Therapy may enhance sympathomimetic effect, treat CNS abnormalities, CNS masses, and hydrocephalus as a relative contraindication due to increased intracranial pressure produced by the ketamine. Toxicity: LD50 dose is 77 milligram per kg in mouse. Toxicity sign: enhanced sympathomimetic effect. Respiratory depression may occur with overdose. Antidote: mechanical support of respiration is preferred. Pregnancy category C. Positive evidence of risk. Only use when no alternate exists for serious problem. Avoid because it cause eclampsia. Hypertension in pregnant women. Lactation not recommended. Interaction: 275 drugs interaction and interacted with ketamine, 7 major interactions, 266 moderate drug interactions, 2 minor drug interactions. Tramadol, diazepam, propofol, vitamin B12 are some of the examples having interaction with ketamine hydrochloride. So adverse effect: increase in blood pressure, tachycardia, hallucination, psychomotor agitations, mental confusions. Brand name: Kylopirol injection, Decade injection, Ketarol injection, Ketalar injection. All this content is taken from FDA website, Drug Bank, PubChem, Medscape, and Pharma Guide. So if you like our content, press like button and turn on notification to get more updates.